Look at you, coughing, and you wore your mask. Did it help you? No.
Halitosis.
You made halitosis sound sexy.
Welcome to Messy Medicine. This is a show where we discuss medicine. Medicine is not perfect. We have differences of opinion, and sometimes the stuff we see is just quite messy. To my left, Dr. Chris Ibikunle. I have Dr. Jocelyn Slaughter here. And to my right, Nicholas Jones. Good to see you, buddy. And I'm Dr. Marc Jean-Gilles. As you can see, we're all wearing our masks because we're in the midst of a pandemic. I'm gonna go ahead and take mine off because I can barely breathe. And we've tested negative and we don't have any symptoms. So I'm gonna say it's safe. All right.
Here we go.
This mask is coming off.
It just don't cough or speak in my direction.
I won't. Now, what type of mask do you have on?
Y'all have the bootleg
I do.
Chinese mask.
Mine's a K95.
KN95.
KN95.
Which is same as...
It's the same.
It's the same.
But it's like y'all have, how can I say, maybe you have Michael Kors, but mine is more like Gucci because it's the N95 by 3M.
Yeah, yours is bougier, right?
It's bougier. Because of the coronavirus, we have shut down the economy, or we had shut it down. It's now reopening. We'll get into that in a minute. I talked to a lot of people. They seem to not understand what social distancing is for. Explain to us what it's for.
So social distancing are efforts that we take to help prevent the spread of this infection.
With that said, we are reopening in some parts of the country. Others are still a ways away from that. Do you think we're ready to reopen?
I don't think we're ready to reopen the economy completely. And when we do, it has to be done at an individual pace.
I mean, we clearly dropped the ball to begin with. And at this point, it's very difficult to say whether we should open or not because we still don't have the measures in place to make sure it's safe. We need to do more testing so that we can identify who's actually infected. We need to know more about, it's a novel disease. So
the downside to reopening the economy too soon, the new resurgence in number of new patients, which again will lead us to a meltdown. So I think this has to be done in a very sensible way.
Let's talk about perceptions in the public. The stuff that I find funny is just people are wearing masks everywhere. And I have a lot of friends, they know I'm in the health field, they know I have N95 masks, and they are desperate for it. I just find it hilarious because, again, these masks, they're not designed to protect you.
No.
Can you please clarify what the masks are designed to do?
Well, the mask is designed specifically to protect healthcare providers who are taking care of patients with known COVID-19.
So are you saying that I don't need to wear this in a grocery store?
No, young lady, you don't.
I'm going to keep wearing mine at Kroger. I may take it off in public.
And I know you will.
even for me, like trips to the grocery store is crazy because I feel like there are more people in a grocery store now than there were before this pandemic. And you see such a wide array of attire. Like you have a mother and a father with masks on, or you may have one member with a mask and the other person doesn't have a mask on.
I've seen people wear their mask in their car by themselves. They want to make sure their car doesn't get coronavirus. I don't know why they're wearing the mask in the car.
You got to get prepared. You got to get prepared.
Man,
you got to get prepared to breathe your own voice, your own breath.
You have to mentally
This is what
get
my
prepared
breath smells
for that.
like all day long. I have to prepare myself.
I'll say that is another benefit.
You know your breath stank.
Halitosis.
You made halitosis sound sexy. Halitosis? Did you just say halitosis?
Well, he's from Louisiana.
I'm from Louisiana. Don't make fun of the way
I'm
you
not. I'm actually loving that.
But let's get back to this. I had a patient. She came in with an N99 mask one time.
That's
contraband.
So the whole point is that it has a better rate of filtration. The problem is if you put this mask on,
It's hard to breathe.
it's hard to breathe.
Yeah.
And N99 is even harder. So she's pregnant. She damn near passed out on my table because she kept the mask on the whole time.
Wow.
The danger in wearing a mask, right? If you're wearing a mask while driving, there is a risk that you can pass out. So I don't think you need to wear a mask while driving.
Please.
If you're by yourself.
Do you think people need to wear masks at all?
I think that the thing is, I'm going to trust the science, right? Look at you, coughing, and you wore your mask. Did it help you? No. So, you know what?
I'm negative. I tested negative.
I know you.
We're gonna have to test you again.
Yeah, you're going to get
It was
tested
tested,
again.
I promise
so,
y'all.
as far as society as a whole, I'm going to trust the science. Could I potentially die from it? I can potentially die from anything. My risk is very low. I'm very well aware that we are not anywhere near a cure. And we have to stop focusing on every little bad outcome. And I'm not minimizing it, but the reality is that patients recover overall. I've had like 4 family members in New York that got it. They didn't even go to the hospital. They were fine. They recovered. You can watch the news media all you want. They're going to tell you about a cytokine storm and blood clots forming in the lungs. These same things can happen with a bad case of pneumonia and a bad case of the flu. Now, I don't disagree with what has taken place. I think that was the safest, cautious way to deal with it. But at this point, the way we deal with each other, the way we don't shake hands anymore, people are wearing masks. I don't even know if I'm in a Muslim country or not. It's just ridiculous at this point. And I think in the end, we're going to find out, hey, it was a bit much. I'm in the minority, but that's how I feel. I think we've gone a little bit too far.
Mark, if you don't mind, I would like to bring up a question that one of our audience member brought up, which is how do we behave as we're reopening the economy?
The sooner we get back to the way things were before, the better. I take my kids to the pediatrician. They say, oh, it's all right if they get a little bit dirty. Why? Because it builds up their immunity, right? So there's herd immunity. And as a community, yes, some of us will succumb, but the majority of us will be built up in immunity so that this will become a non-issue in the future. This is part of life. Not everybody's going to win. Not everybody's going to do well. And it sucks to say that, but what will the majority do? And in this case, the overwhelming majority will be fine.
A lot of people don't like to hear that, but as physicians, a lot of us feel that way, and it's hard for us to say it.
Well, I'm going to be the one to say it. You can't save everybody in medicine. And there is also a negative effect of shutting everything down, okay? People can get hurt emotionally, psychologically, and of course in their finances. So you don't want those people suffering either. Why do you think we have high rates of opiate use and depression? It's because people fall down on hard times. So you may be trading one potential benefit of preventing the spread and acquiring another negative aspect of the disease and social distancing. So I just find it funny that we're just not like shaking hands. Never a high five again.
Well, I don't think people are going to be shaking hands for a long time. I think that might be over. I think that moving forward, I feel like every time you come into a new place, you should wash your hands before you come in and when you leave. And if you're sick, don't go out.
At what point do we say enough with the social distancing? Because again, if you're waiting for a cure, you're talking about 1 year at best away. If you think this is going to eliminate the disease, that's false. That's not happening. This disease is here to stay. It's not going anywhere.
It's going to eventually go somewhere.
No. We have the flu, A and B, every year to stay.
But this is different. This was a very, very rare combination of 2 viruses that met that really only met because of the region that the viruses are in, and it's super rare for something like this to happen. So I think that we're going to eventually get a vaccine. We'll eventually eradicate it.
I don't think it'll ever be eradicated.
It won't. You can get it under control, but that doesn't mean that nobody's never going to die from influenza
every
A
year
or B.
Someone's going to die from
coronavirus. That's just a
specifically
fact.
the COVID-19.
Right.
Yes,
That's the question.
they will die from it, yes.
Well, I think some people are going to stay inside until they get a vaccine. And that's supposedly, 2021.
So rather than jumping from one extreme to the other, I would just advise the audience to practice common sense, such as washing your hands. Mm-hmm. If you're sick, go see a doctor. Self-quarantine will remain. And I wish you the best of luck and hope you stay safe.
Thank you for tuning in to Messy Medicine. If you enjoyed this topic and you have questions, please mention so in the comments below. And of course, be sure to subscribe. Till next time.